Hey, sleep warrior! Are you or a loved one experiencing excessive gas from CPAP use? Besides being uncomfortable, these issues can be downright embarrassing. No thanks. This is called aerophagia, and it's a common issue faced by many CPAP users. It occurs when air is swallowed and enters the stomach instead of the lungs, leading to discomfort, bloating, and excessive gas. This problem can disrupt sleep, ultimately affecting overall therapy adherence. But why does aerophagia happen, and what can be done about it? The primary cause of aerophagia in CPAP users is simply high pressure settings. When the pressure is too high, it forces air into the esophagus rather than just the airway, leading to swallowed air and subsequent discomfort. Now, one potential solution to the excessive pressure is the VCOM, a device that reduces inspiratory pressure without affecting the therapeutic pressure. And the VCOM can be purchased online without a prescription for just about $30. You could also discuss pressure adjustments with your sleep provider. Maybe your pressure can be turned down a little bit and still be effective. Lastly, you can try sleeping on your side or utilizing the ramp feature on your machine, both of which can lower the overall pressure. Another cause of aerophagia is the type of mask used. Full face masks are more likely to direct air into the stomach as air passes over the tongue and esophagus on its way to the lungs. And switching to a nasal mask can really help, and you can use a chin strap or the Somnoseal if there are issues with mouth breathing or dry mouth. You'll also want to be sure you have a good seal on your mask, since mask leaks tend to result in your machine blowing higher pressures to compensate for that leak. Finally, anatomic factors can play a role. The way your body was built, with the trachea going to your lungs being right behind the esophagus going to your stomach, can make it difficult to completely avoid swallowing air, especially if high pressures are necessary for treating your apnea or you're stuck using a full face mask. In these cases, if there are no contraindications, over-the-counter gas relief products like Gas X may provide some relief. Other options include ginger or peppermint tea, both of which are known for their natural anti-gas properties. Remember, these are general suggestions, and it's important to discuss your specific issues with your sleep provider to find the most appropriate solution for you. So, by addressing the underlying causes and implementing these strategies, I hope you can reduce the impact of aerophagia and improve your CPAP therapy experience. Thanks so much for being here. I will see you next week.